Hi, welcome back to another episode. I'm Dr. Sylvia. It's so good of you to join me this evening. This is AskAwayHealth, and tonight we're talking about menopause treatment that has nothing to do with HRT. Okay, you guys will remember that I promised we were going to dedicate videos on the channel for the whole of October to menopause awareness, and I think I've let a couple of non-menopause related videos slip in, but most of the videos on the channel this month have been all about menopause, perimenopause, HRT, and so on, because it's October is as well as many other things like Black History Month, Breast Awareness Month, or Breast Cancer Awareness Month. There's so many things being marked, but it is also Menopause Awareness Month, and I really wanted to spend some time trying to consolidate information on the channel. So that's what we've been doing. But I hope you're well. Thank you so much for joining me. It was a very busy week last week, but I'm so glad that we're here. I hope you've had a restful weekend. But yeah, let's get into things. If you're watching live, thank you so much. I'm happy to take questions related to the subject, specifically looking at what alternatives can you use to manage menopause symptoms. Let me just put my disclaimer up, just to remind you that while we provide medical information here, I cannot give specific medical advice or treatment to anybody, because this is not just a platform for that purpose. You should really speak to your medical practitioner for that reason, to get information that is tailored to your own medical background. So apart from live streams like this, we also publish shorter videos on the YouTube channel, but there's also my website called askawayhealth.org, and there is the free and paid versions of the email health information service. By free, I mean there is a symptom checker tool, so that tool you can use to put any symptoms that you're experiencing, type them into the checker, and it should sort of collate it together and provide you with a list of possible diagnoses that you can sort of use to read up and learn more about, or you can use to have a conversation with your doctor. But there's also the paid service where if you really want to get tailored information about conditions that are on your mind, you can send them to us via email health service, and myself or one of our other team members will come back to you with the answer. So those are some of the things that we have going on. What's really exciting for me is I'm working on a hormone health course. I haven't really concluded what the title of that course is going to be, but I've been listening to feedback from so many of you watching my channel, watching my videos, and the conversation is around concerns with hormone balance, and that covers so many different conditions. So I have a survey that is going on at the moment, and if you follow my community posts, and if you get our email newsletters, you know that I have been asking for people to please respond to the survey, send in your thoughts, send in your opinion, to help us shape this course so that it is really suited to everything that you would want a hormone health course to be. So I will put the link. I don't know why I didn't think of doing that before. Actually, I'll put the link to the course in the description box, and I'll probably put it in the chat at some point if I remember. I'll put it in the chat so that you can please click onto that link, go on, and let me know what your thoughts are around hormone health, what your challenges have been, what your concerns are, what you would like to learn about your hormone health, and so on. So thank you so much for watching. Let me know where you're watching from tonight, and like I said, please send in any questions that you feel you'd like us to cover. We're talking about menopause, managing menopause without HRT. So let me just take a quick break, and then we'll get on to the very first of, I think there's 7 particular headings I want to cover tonight. Let me take a quick break, and I will be back with you in a minute. Fantastic. We're back. So hello again. Welcome to people watching me, not just on YouTube, but on Facebook and LinkedIn. I'm sorry, I sometimes forget to say that I know that you're watching from Facebook and LinkedIn as well, but thank you so much for joining the stream. So menopause, we're talking about symptoms that can develop in some women, not everyone, in some women as we approach the end of our childbearing years. So we know that menopause is what's that point where a woman comes to when she has not had a period for 12 consecutive months. And the period before all that happens, sometimes it can begin 4 years or 7 years or 10 years before the actual point where you can count back 12 months and you haven't had a period. That's called perimenopause. So what I mean is that for most women, we might spend 4, 5, 6 years, it varies, experiencing some kind of changes before we get to that point where we have not seen our period for 12 months. So that all that long time, all that 4 years or 5 years, and some women even up to 10 years is what we refer to as perimenopause. You can get the same or similar symptoms to what you will get as you reach menopause or after menopause. So here are just some of the symptoms that you might experience. Some schools of thought say, oh, we have 48 symptoms of menopause. Some say we have 62 symptoms of menopause. We can all experience different symptoms to different degree. So you can see that there's a whole list here. I mean, there's a lot more symptoms. There's not up to 48 written here clearly, but there's so many different things that women might experience as we go through the menopause, and we're going to address some of them. So one of the most important things, I think, and even if we're going to talk about HRT, one of the really important things is about adjustments to habit or lifestyle changes that you could make, and they can go hand in hand with HRT. But I really don't want to talk too much about HRT today, because next week, which is the final video, next week Sunday will be the final video for the Menopause Awareness Month series, is dedicated to HRT, because the theme actually for Menopause Awareness Month this year is hormone replacement therapy or menopausal hormone treatment. So that I will dedicate that video to sort of looking at HRT, the types of HRT, what different types of HRT mean and how they work or how they are used. And please, if you're interested in that, you're watching this and you want to get into that particular subject, I'm dedicating that for next week. So without much further ado, let us start. The first one is diet and nutrition. Let me just state, please, I forgot to say that as well, as I tend to. I am a medical practitioner. I'm not a homeopathic doctor. I'm not a naturopath. So I don't have experiences so much in how effective herbs are. I don't have working experience, I mean, in how those work. We have a little bit of science, a little bit of data, looking at how some alternatives to conventional medical treatment like surgery and drugs could work. We have little data, and it's not the case that conventional medical practitioners like me will say, oh, the herbs and all that just don't work, or we don't think that lifestyle is important. No, that's not the case. We look at holistic medical care. Those of you who are regular on my channel know I'm always talking about that, and holistic care is so important. It's not just taking tablets or having surgery, or this is about what you're doing, your own physical and mental well-being, and that includes things like your diet, exercise, sleep, and so on. But I wanted to make it clear that I'm looking at, or I'll be talking about methods that women have used and have said, oh, this has helped me, and I think it's reasonable to listen to that person. I may not have the exact data or have it available to me, the exact data suggesting that this particular method is effective, but just going by the lived experience of people that I'm familiar with, some reports that I've written, then I'm going to be discussing some of these. So while I can't endorse all of them, I can suggest and say, well, we've heard that some people have had benefits with this, and I think that's a good way to approach particularly some forms of alternative medicine where we don't have all the evidence, because it might work for some people and it might not work for others. So you go into it with an open mind. The most important thing is be aware of any potential safety issues or safety risks with yourself as an individual, depending on what your medical background is, or whatever medical condition that you have, or medication that you're taking. Be careful about adding any other remedies. Don't think that because they are natural, they may not cause any harm. They could. So it's always important to have that at the back of your mind. And the fact that perhaps there isn't so much evidence, and perhaps it might work for some people and it might not work for others. Okay, so let's go. The first one I want us to talk about in terms of alternative measures that you can use to manage, be healthy, be well during perimenopause or menopause is diet and nutrition. So what am I talking about? Diet and nutrition. Well, I think it plays a critical role, because we know that there are certain foods that are, even without talking about menopause, there are certain foods that are not good for managing health. We know that there are foods that are processed, high salt foods, excessive fat or bad fat food, excessive sugar, and so on, are harmful to our bodies. We know that they can if you could have issues with excessive inflammation or chronic inflammation that can lead to ill health even without going into menopause. So this is something that is important as we get into that age, and it may be that you as a woman need to make strategic changes in your diet or in your eating habit or in your approach to food altogether that may help to manage some of those symptoms. For example, spicy food and hot flushes. If you're somebody who experiences hot flushes or night sweats, then cutting down or cutting away from spicy foods, that is one way that you can help, to potentially help to reduce the impact of those, things like coffee. But, I'm jumping into it. So one of the really important things is lean proteins. So lean proteins that could be either plant or animal-based proteins. And why proteins? Why are proteins important? Well, we forget that estrogen, the hormone, is one of the hormones that starts to fluctuate as we enter into perimenopause. Estrogen, progesterone, testosterone, and a group of other hormones, they start to fluctuate as we get into perimenopause. Of course, the most critical, as we know, for the time being, is estrogen. Estrogen is such an important hormone. It is not just about ovulation and menstrual period. No, it is so important, from our brain function to the function of our heart, to the function of our blood vessels, to the function of our muscles, our bones. Estrogen, even thinking and all that, estrogen is so important. So one of the effects of that loss of estrogen is the loss of muscle mass as we get into perimenopause. And what do you need to build up your muscle mass? Protein. So one of the foods that's really important as you get into perimenopause, menopause, is I'm looking at your lean protein. So it's really important to maintain your muscle mass. Protein is essential. So lean meats like chicken, turkey, eggs, fish that can provide you high quality protein. You have fatty fish like salmon and mackerel that are rich in omega-3 fatty acids. And they are also good to help to reduce that inflammation I was talking about and help to support your heart. Then plant-based, for those of us that don't eat animal proteins, plant-based proteins like lentils, chickpeas, tofu, high in protein and fiber. They would help with digestion, help with energy levels. There's also things like quinoa and almonds that provide protein and healthy fats. Okay, so still talking about your diet and nutrition, different types of supplements will also come into play. We talk about things like phytoestrogens, foods like soy, flax seeds, contain phytoestrogens that can mimic how estrogen behaves in the body. So they may be able to help in reducing hot flashes and improve the hormone balance. It's really important to maximize antioxidants, anti-inflammatory foods. So think about your fruits and vegetables, nuts, whole grains. All these things help to reduce oxidative stress and inflammation. Berries like raspberries, strawberries. When it comes to vitamins and supplements, calcium and vitamin D, because the other thing I just mentioned was the effect of dropping estrogen on the bones. So it's not just muscle, but also your bones. Because as we lose estrogen, we also lose bone density during perimenopause. So it's really important that we're protecting our bones, taking calcium, vitamin D, whether as supplements or whether in food sources. So food sources that can include things like your dairy, fortified milk, greens, those different eggs, cheese, and all that will help to build up and maintain your vitamin D levels. It's really important, especially for those of us living in the UK like me, where you may not have exposure to sunlight as you would have in other parts of the world. Really important to keep on track of your vitamin D levels. You can do blood tests to check your vitamin D level. If it's low, then your levels can be replaced with supplements or treatment to get it back to normal levels. Apart from calcium and vitamin D, magnesium is important, really important vitamin supplement, for regulating various body functions, including your muscles, can help with sleep and mood swings as well. And then collagen. I was at a seminar a couple of days ago, and someone asked about collagen. And to be fair, I didn't really have so much. I hadn't really thought so much about collagen. I know collagen as a protein and important in skin health, even digestive health, but it's a supplement that you might find useful, especially if you find that you're having very accelerated skin changes. There isn't so much evidence to support that it will reverse aging or anything like that, but it might be something that you could use to keep the skin supple and healthy, support skin elasticity, joints, support your joint function. So either getting supplements from buying collagen supplement tablets from shops, or natural sources. Are a good source is bone broth, which is when you simmer for a very long period of time, simmer animal bones. So it could be chicken bones or meat joint bones or turkey bones. Just simmer for a long time, as if you're cooking stock. Okay, but let it simmer for 6, 12, 24 hours. You really soften the bone and get a lot. That by the end of that process, you have collagen rich material, a very strong source of collagen. So that can be one way of getting the collagen that you need. So I think what I'm trying to say, and I think what is really important, is having the mindset of, if you were such a person before menopause that your diet was really about a lot of processed food, or you weren't really paying much attention to the components of the food, now your thinking has to be such that you need to help support your body based on what it's losing thanks to the dropping estrogen levels. And the key things are around protein loss, around muscle mass dropping. The other things around your bone strength or bone density, and then other supportive things like antioxidants, anti-inflammatory foods that will support all that and help you to not only maintain a healthy weight, but support overall body health. So that is that for food. There's a lot more that can be said, but I really want to make sure we get through all the different sections that I want us to talk about. And please don't think that if you're going down this route, then it's completely no to HRT. They can be combined, but I'm really talking about somebody who, either because they don't want to, or they are not able to have HRT at all, then these are measures that you can use to get really good effect, restore some kind of balance to your system, and hopefully overcome a lot of those potential side effects. Or those potential complications that come with menopause. Okay, so we're going to go to the next one. But before I do that, let me just check out a couple of comments that have come in. And hi from hello, dear Master Songwriter. Thank you so much for joining. Greetings, Dr. Sylvia. How are you doing? I'm doing well. How are you doing? Thank you so much for joining. Regards to your family, thank you so very much, and yourself. Thank you. Hello, Gift. Gift Onoha says good evening. Thank you so much for joining. Thank you so much for joining in, everybody. Really appreciate your joining here. Please don't forget to give the video a like and share in the comment section. What do you guys think about diet? Are you around perimenopause, or are you have you reached menopause or even past menopause? What have you made any changes to your diet? Have you seen them have some effect? Are you somebody who used to struggle with hot flushes and then noticed that you made a change in your diet and you saw some benefit? Please let us know in the comment section. I'm going to take a quick break and then we'll come back and go to the next part of the video. So welcome back. Thank you so much for watching. How are you guys doing? Thank you so much. So we're talking about no HRT menopause natural remedies. We've done number 1, diet and nutrition. We went through a 5, 6, 7 separate options or considerations and changes that you should make to your diet. As long as you're within that menopause or perimenopause stage, you should really be intentional about incorporating this type of foods into your diet and cutting away all those things that are not healthy, processed foods, trans fats, sugar, salt, intentionally adding things that will help you to fight inflammation, fight oxidative stress, and so on. So let's go on to number 2. Number 2 is exercise. So number 2 is exercise and movement, regular physical activity. So we know we always say, oh, be active, get active and all that. It's even more important during perimenopause and menopause. And here is why I've already mentioned it in this video in these last few minutes. The reason is because thanks to the drop in estrogen levels, we're losing muscle mass, we're losing the density of our bones. And one of the ways to help to support that, to help to strengthen and maintain our muscle strength, maintain our bone and joint strength is by regular exercise. So what type of exercise? I think the most important is weight training and resistance exercise, because that's what will help to strengthen your muscle and help to strengthen your bones. So really, whatever routine that you want to get into, whether you're going to the gym, whether you're at home, incorporate a kind of routine where you're lifting weights. Okay, you can start small and build up, but strength training helps to prevent the muscle and bone strength loss that happens around perimenopause. So whether it is body weight exercises or using free weights or using resistance bands, all of those are effective ways of, strength training that can help. Then, of course, aerobic exercise is helpful. You're increasing your heart rate, so you're burning calorie. So this could be anything from walking, cycling, swimming, dancing, whatever it is, just to help to get your heart rate going. And I still use at least 3 exercise days. At least you can do more, but at least 3 exercise days, at least 35 to 40 minutes at least. If you can start small, that's fine. You don't have to go to the gym. You can do this at home, but incorporating that into your regular lifestyle will make a considerable change for you. So activities like walking, cycling, all that, they will help to reduce weight gain, and of course the benefits to your mood. Let's not leave out things like yoga and Pilates. I think those are really important because they not only combine strength training, they also help with mood. They also help with emotional stress. And if you remember from this this word cloud I shared at the beginning, even though it doesn't really show it very much, but for things like mood swings, emotional distress, and anxiety. Okay, so it's on here. So there's depression, there's anxiety. If you look at the bottom, for some of these symptoms that can affect quite a lot of us women in perimenopause or menopause, if you're interested or if you're into yoga and Pilates, actually those could help. I mean, they're forms of exercise, and any form of exercise that you enjoy doing is good. It will help to release those hormones, the happy hormones, the calming hormones that help to keep the mood stabilized. So there is a lot to be said about the benefits of exercise, and I put it as number 2 key thing that you should not ignore when you're thinking about you don't want to use HRT. So what options do you have for dealing with menopause symptoms? So exercise can help to reduce the potential impact on the muscles and on the bones, can help to improve your mood, can help to improve your weight, lose weight and maintain weight, can help with your heart health, all those things that potentially could be impacted, very significantly impacted for some women during menopause. Okay, so we're talking about menopause, we're talking about treatment remedies without HRT. That's what we're discussing particularly today. And I have already said that next week, for those who want to hear all about HRT, who want to ask about HRT, that is the week for us. And Okay, so Master Songwriter says osteoporosis. Yeah, so that is osteoporosis means thinning bones, and that is something that potentially could happen as you enter into menopause because of the reduced effect or reduced availability of estrogen that helps to support our bones. So calcium, vitamin D, supplements, rich sources of calcium and vitamin D. These are really important to help you manage this condition, to help you prevent it or prevent yourself from getting into a situation where you end up with thinning bones. Okay, so we're going to talk about the very next one. I will take a very quick break, a very, very quick break, and then we shall continue. Okay, so this is everybody's, well, okay, I'm kidding, but this is almost everybody's favorite bit. This is where we talk about herbal remedies and supplements. But I think it is the favorite subject that people like to talk about. What herbs, what supplements can I use? What would help? Because people don't want to talk about HRT. We're afraid of using HRT. And last week I talked about HRT and safety concerns. And if you're somebody who you've heard that HRT is bad, is dangerous, please go and watch that video, because that video was about context. There's a lot of misinformation, and I think it is only fair. You're only being fair to yourself to get the right information and make your judgment based on the right information, not hearsay, not misinformation. So please check out that video. It's about HRT risks and benefits and context. That was the last live stream I did. And like I said, we're talking a lot about HRT, how it's used, the differences, and just, trying to iron out any misconceptions or just clarifying things to do with HRT. But it is the turn of the natural remedies, and now we're talking about herbs and supplements. I've mentioned a couple already. Collagen, I've talked about that, but the common ones that we often mention when somebody doesn't want to go down the route of HRT, the first one is something called black cohosh. Black cohosh. It's a herb that's often used to reduce hot flashes and night sweats, and thought to be, for a number of women who use it, quite effective as an alternative. Please don't forget, and I will always place this disclaimer just in case somebody missed it when I said it earlier, that because a treatment is said to be natural, herbal, or alternative, doesn't mean that it may not be toxic. If it's not pure, it could have bad effects. If it could interact with other medicines that you're taking. So please always have a conversation with your medical provider. Always do your research before you buy any of these supplements, no matter how fancy the store is, and before you start using it. So black cohosh is one that is a common preparation. There's red clover that contains phytoestrogens. And I mentioned at the beginning when we were talking about diet and nutrition, I mentioned phytoestrogens. These help to balance hormones. They can act like estrogen. Some of them can act like estrogen in the body, so it can help to balance out the hormones, and we think it might help with hot flashes and night sweats as a result. Again, some people find there are benefits with them, some people do not. Again, we don't have enough strong evidence to show that they definitely make a sustained effect, but there are people who have reported benefits on their symptoms. So it might be useful, it might be not, it might not be, it might be not, it might not be. But again, the what's the word now? The caution I'll put is make sure you check in with your medical provider before using it, especially if you're taking any other medication or you have other medical problems. Evening primrose oil is one that I'm sure we're so very familiar with. If you have moms or aunties who, especially if you're younger, especially if you're not yet perimenopausal, but if you are, then I'm sure you've heard of evening primrose oil. Is very, very commonly sold as a menopause treatment, and it's known to be quite useful for hot flushes and night sweats, also for mood swings. So that's an option that many people are familiar with, and can be used as an alternative to HRT. The other things like Vitex, castus, Agnus castus. Sometimes it's used quite broadly for balancing hormones. used for things like premenstrual symptoms. It's thought to help to reduce mood swings and, just calm the mood and calm the emotions. So it's something that it's thought could have a place for, especially for somebody who's experiencing this kind of anxiety, especially to a mild degree. It may be something that's worth trying, especially if there are no reasons why you can't have it, if you don't have any medical conditions that could, make it a problem or make it unsafe for you to have them. Other supplements, again, I've mentioned earlier, but I don't want us to forget, are things like magnesium, which is vital for so many different functions in the body, but it's also valuable for mood swings, can help with sleep. We mentioned collagen. We talked about its value for skin and the joints. One of the effects of menopause, of course, as we lose the estrogen, is how the tissues become thinner. That applies to skin tissue as well. So the collagen cooled help to repair some of that loss and help to keep tissues a little bit plumper for a longer period of time. And it can also support bone strength. There's also omega-3 fatty acids. I mentioned those earlier when we were talking about lean proteins, but it is found in fatty fish like mackerel, salmon. You can also find it in flax seeds, and that's really such an important supplement for helping to fight inflammation and helps with the health of our heart as well. So quite a few supplements that are available, from red clover, black cohosh, magnesium, agnus vitex. What are the other ones? We talked about magnesium, we talked about collagen, calcium, omega-3 fatty acids, quite a few herbal options, alternatives that can be used for treating menopause or perimenopause symptoms when you don't want to, or when you cannot go down the route of HRT. All right, so let me take a quick break. I'm still looking out for questions. If you have about these non-HRT alternatives, please let me know in the comment section. Give this video a like if you've just caught up with it and you're just interested in the conversation. And if it's just providing you information that you want to have a further conversation with your doctor, please give this video a like. I shall be back with you in a moment. Okay, so we've come to the part of the video where we're talking about stress. Stress. No, we don't want to get to that point. That is the kind of stress we don't want to get to that point. But there is a lot to say about stress. And if you're perimenopausal, or if you're just at that age where you have kids, you are working regular, either you're self-employed or you're an employee, you have responsibilities that contribute to so many different types of stress that you can feel. So you don't need extra stress coming from your body not functioning in a way that you expect it to. So how do we deal with stress-related issues around perimenopause, and we don't want to rely on HRT? And to be fair, HRT can be very good for certain symptoms, particularly the night sweats, the hot flushes, can be quite good for mood swings as well, and vaginal dryness. Those are the main ones where it's quite good at. So there may be other symptoms that it may not be so effective at, and that's why I said usually in terms of treating menopause, of course, it depends on the symptom in particular that we're trying to address. HRT alone may not be the answer. It might need to be combined with other things. But in terms of managing stress, this is where we're sort of looking, an opportunity to be very reflective. So mindfulness and meditation. I talk about this, quite a lot, and personally find it useful to spend some time, whether it's in the morning or whether it's at parts of the day when you're by yourself and just sort of can focus. And it might not be something you have to spend hours doing. You might spend a couple of minutes, 5 or 10 minutes in a particular activity just to calm your mind. So for those of us who can incorporate mindfulness practices, for those of us that can incorporate meditation, those of us who are people of faith and can take time to pray, you might not necessarily have to go to the church or the mosque or the temple, but you can spend some time, and those are activities that can help to center and bring focus, bring some kind of calm to your activity and to your schedule. The other thing is learning deep breathing and relaxation exercises or techniques. They can be very helpful. Learning how to, especially for people who are in quite high pressure jobs. Maybe there's a quite demand, and not necessarily just jobs. Maybe it is a high pressure situation around you at home the time, and you might just need to learn techniques to help to calm yourself down. They can also help with dealing with things like hot flashes. When you experience them, learning to slow down, calm yourself down. That might be one way of helping to calm things down. But we also have therapy like CBT, which is cognitive behavioral therapy. And this approach can help to deal with mood swings, help to deal with depression, changing negative thought patterns. I'm working on a video at the moment where I'm really looking at the challenges that I personally experienced during perimenopause and menopause, and not so much the physical symptoms per se, but actually a lot of the mental things that impacted both my work as a professional and my personal life. And sometimes we talk about the physical things, joint pain, we talk about hot flushes, we talk about bowel problems, but things like the tiredness, things like the brain fog, things like not being able to concentrate, loss of control and all that, those are really tight issues that you may not be able to properly put into words and to say to somebody, I'm experiencing this, but they are a real part of the situation. So CBT could help with things like depression, changing negative thought patterns. And for those who can access a very good practitioner, acupuncture and massage. Now, how much evidence? We may not have too much evidence at the moment, but there are quite a number of people who are very experienced, registered acupuncture practitioners, and who have clients who have gained some relief. And it could be relief with things like hot flushes. It might be relief from things like joint aches from the acupuncture. So it could help to promote relaxation. And I think, and I emphasize, it has to be somebody who is good at what they're doing, who is experienced. It's not just anybody who says that they can be an acupuncturist. Please do your investigations, do your research. So these are some measures. These, in addition to other supplements that can help to relax the mood, that can help to calm you down. These combinations can help to provide a little bit or provide some relief from stress that you might experience during the perimenopause or menopause. So I hope that's useful. Please let me know in the comment section, especially if you're watching on the replay. I would like to know what ways that you use to overcome stress, or that you manage stress, especially if you're perimenopausal or menopausal, and not using HRT or not relying on HRT alone. What other activities can you do? Please let me know in the comment section. Share, and one or two other people might also benefit from it. So let me take another quick break, and then we shall go on to the very next item. Okay, welcome back. So we're making very good progress. Just check comments again. Oh, thank you, Master Songwriter. I appreciate that. Thank you so much. Do you have any tips about stress? I put you on the spot. We're just talking about stress. How do you manage that? That is without using any kind of therapy. And are there any other tips that you can share with the rest of the viewers? While you have a think about that, let us move on to the very next remedy that I have for tonight, and it is managing sleep. Oh, I love this. Is my favorite topic. This is my personal favorite. talking about sleep hygiene. How do you manage sleeplessness? Because this is a very common disturbance during perimenopause, menopause. If I, when I think about it today, and I it was just funny. I was experiencing difficulty sleeping, I put it down to everything else except could it be perimenopause or menopause. And that was so interesting how looking for solutions here and there, but just not keying into the fact. And I it makes me laugh because this was my own personal experience, and I use that when I'm hopefully helping my patients. And I think because I shared that and because I've gained knowledge from that experience, it's easier for me to be able to say to somebody, please, you really need to pay attention to sleep, because so much is lost with disrupted sleep. But anyway, that's another conversation. Let's talk about some of the things that we can do. The strategies is really important. Looking after your bedroom where you're sleeping, really important to make sure that the environment is suitable for sleep. And I know you sound, what am I talking about? There's the bed, what else do you need? Yeah, sure. But it's cool enough for you to sleep in. It's a comfortable bed, comfortable pillows, supports your weight, supports your back. So you're looking at a good mattress. There's some people that pay so much attention, and deservedly so, to their mattress, their bedding, their pillows, change them frequently, a couple of times a year, because they want some mattress that is not sunken, a mattress that supports their weight. These are really important things, not just for people who have joint problems, or to maintain overall health and well-being. So keep the bedroom cool, to promote better sleep. Keep it dark to promote better sleep. Keep away distractions like television, especially if you're someone that has trouble sleeping. Keeping the television on can continue stimulating your mind. So turning it off well before you're about to settle into bed. Some people might find it useful to have a bath, to get into that kind of routine. So as you get into a bath, get your makeup off, and get into your nightwear. All that is sort of preparing your mind. You're about to sleep, helping you to shut down. Cooling pillows, cooling bedding can help with night sweats as well. Establish a regular routine. We do it for kids, but you get to the point where you're struggling with your sleep pattern, especially around perimenopause, and it's probably time to apply that routine to yourself. So like I said, establish when is the time that you're shutting down at work, shutting your computer down, shutting down in the kitchen or with the kids or whatever, and then saying this is now bedtime, and then you're starting the progress into bed and doing your cleaning up routine and all that as you get into bed. Things that we sometimes ignore, or we forget sometimes, not to have coffee or cut down coffee, especially in the late afternoon or late evening, as it's excuse me, as it gets to the point where you're getting ready for bed, because of the effect of caffeine and its potential disruption on your sleep. Of course, there are different herbs and supplements, like chamomile tea, for example, is a good example. Melatonin is something that can help for sleep. That's something that your doctor could prescribe for you. Valerian root, which is found in some over-the-counter medication. What I would say, of course, is please check with your practitioner, especially if you're taking any other medication. And I'm sorry if I keep saying this over and over again. It's just that it's really important that whatever you're taking, you should clear it, and it shouldn't clear it with your doctor. It shouldn't cause any harm with any other medicine that you're taking or any other condition that you might have. Cotton underwear to go to sleep in. Some people go to sleep in the nude. Anything that can help you feel comfortable. Okay, help you feel comfortable. Air conditioning, I've talked about a cool room, fan or air conditioning, open windows, whichever it is, just to help you feel comfortable as you get into sleep. So I'm good at taking I'm good at giving advice. However, I don't take my own advice. Oh gosh. I know the feeling. Yeah, it's different conditions can affect your sleep pattern. It all depends. I think what might help is narrowing down what is it that is contributing. Is it a busy mind? Is it pain that is making sleep difficult? I think because it could be so many different things, and you need to sort of tease and narrow it down to what exactly is it? Is it the type? Is it the way the bedroom is structured? Is it the light? Different things. Sometimes it might be just worthwhile sitting down and going through point by point. What is your experience as you get into bed? So if it's a physical condition that's impacting your sleep because of pain, for example, then it might be that it's important to speak to your doctor about, the pain, managing the pain properly. But I'm sorry to hear that you're struggling with sleep, master songwriter. I hope that is something you can have a conversation with your doctor about. Yeah, I have all the herbs you've spoken about today. Herbal remedies are my go-to with caution. Yeah, that caution is really important. That caution is really important. I I think that, and lots of people want to go down the route of herbal remedies, and that's fine. Know why you're taking them. Make sure they're from a good source, and make sure that they're okay for you. Always consider yourself as an individual. If you don't have any medical conditions and no other medication that you're taking that could cause a problem, then it's worthwhile having a conversation with your doctor about it. Okay, fantastic. So we are making progress. We've talked about sleep. I think sleep is one of the key things, one of the big things that we struggle with when it comes to our experience of menopause. So I will take a quick break, and then we'll come on to the very next one, which I think is to do with sexual health. Okay, so let's take a quick break, and I will be right back. Hi. Okay, so are you from Jamaica? You love her. I know you guys are heavy on herbs. You should be telling us a lot about these herbs that I'm talking about. It's what local roots do you guys use for sleep in particular? Please tell us. The preparations. How do you put them together? How do you make them? It's so interesting to hear. Okay, so we're back, and we're still talking about non-HRT remedies for managing menopause. And I want to talk about one that's really important, particularly because we don't talk about it so much, because it's not easy to talk about it so much. And we just, especially many women, just sort of ignore it, or, well, no, I wouldn't say we ignore it. I just think I think we just give up and endure. That's the word I'm looking for, is we endure it. And this is around sexual health and dryness. So this video is not going to be dedicated all towards discussing that subject, but I hope that us having a conversation about it here means that whoever is watching this is inspired, if it's a problem for you, to be able to speak to your doctor, because many times there are solutions. In fact, I have 2 videos, and I hope I remember, when I'm sort of finishing up the description for this particular video, to include the links in the description box here. I have videos that we talk about causes of painful sex, treatments, so including vaginal lubricants, vaginal moisturizers, talk about them in great extent. If I remember, on the treatment for vaginal dryness, I think I went into over 10, maybe 13, 14 different treatments. So there's treatment out there, but the problem is that we don't often talk about it. But what are we referring to? So again, thanks to estrogens, the reduction in estrogen, one of the things that happens is the effect on tissue. Tissue dryness. Tissue is not as plump and elastic as it used to be. So that can lead to vaginal dryness because of the lack of estrogen. It affects all that area, the vulva, the vagina. So women can have problems like painful sex, bleeding with sex because it's painful, because the tissues are dry, the tissues are thin, even problems with urinating, Though all those things can happen simply because of that change in the estrogen levels. So what is it that needs to happen? Well, first of all, please have a conversation. Please be able to say to your doctor that you're experiencing this problem. Let us not be shy, because your doctors are trained to have this conversation. In fact, many of us are even trained to start asking, not to be proactive, actually, to be asking about these things. But if your doctor doesn't, then please, feel confident to say you're experiencing problems in this area. Ideally, if you come to the doctor and say you're experiencing vulval or vaginal itching, they should examine you. Okay, my trainer used to drum that into my head when I was still training many years ago, and I then had a patient for whom I realized that what had been drummed into my head, how important it was, because this lady came, and this is going back so many years, came and she had problems, vulval itching. You might think, oh, vulval itching is probably thrush, but hers had been going on for quite some time, and she was one of those people who'd taken herself off to the chemist and she'd gotten a prescription for canesten to treat the supposed thrush, and it wasn't getting any better. It had been going on for so many weeks. So this is one that you just, you couldn't just say, oh, it's thrush. There was no discharge, none of the things that you would associate so easily with thrush apart from the itching. And so I said, okay, let's have a look, because it had been drummed into my head. Look, have a look when a woman comes and complains about things like this. And lo and behold, she had a condition called lichen sclerosis. Now, that was not menopause, but it does happen in women, although it's more common in older women compared to younger women. And lichen sclerosis is a skin condition that causes very, very uncomfortable itching, very distressing itching. We're not 100% sure what causes it. But one of the ways that you can detect it, and it's very easy to detect because it causes a change in the appearance of the tissue of the skin. You will see it. It would look like, whitish. You see whitish patches in the area where this condition is happening. You will not find this in other conditions. So it tells you immediately this is what is causing the problem. And the treatment is so straightforward. But if we just assumed and continued treating for thrush and giving this tablet and that tablet and this tablet, we wouldn't have known what was going on. So ideally, your doctor might want to have a look just to be sure what we're dealing with. I'm going into that story just to explain why your doctor might need to examine you, in fact, should examine you. So it's really important. But yeah, let's talk about what we can use for vaginal dryness that is as a result of menopause, and we don't want to use HRT. HRT option will be something like vaginal estrogen. But in this case, we're talking about things like vaginal moisturizers and lubricants. So you can get this over the counter. There's Replens, that's a very popular vaginal moisturizer. Lubricants are sort of different in the sense that you can apply lubricants before sexual intercourse, but vaginal moisturizers can be your regular day-to-day, or they can be used for a couple of times a week kind of function, just to maintain the tissue and keep it supple. So it's a good idea. If you're experiencing this, is the first thing that you can do. You just go. You don't need a prescription for this. You can just go to the chemist and have a look at what's available as vaginal moisturizers. If they don't work, if you don't find them effective, then please come and speak to your doctor. Another thing that will be useful, especially for women who might be experiencing, frequent problems with passing urine, they might experience irritation as they're passing urine, or pain or discomfort. They might even experience frequent infections. So obviously we need to treat the infections, but also look at, strengthening the pelvic floor. If you remember, the pelvic floor is the muscle, the sheet of muscle that's underneath the womb and your bladder, holding up all those organs together. And sometimes, especially as we grow older, it will weaken. The sheet becomes lax, allows those tissues to fall. Sometimes and when this happens, it can lead to problems, different types of problems, prolapse of the organs, prolapse problems with control of the bladder. So strengthening the floor, there's some things that you can do if it's a mild weakness, and that would be, squeezing on the muscle. And if you just think about it, if you were sitting on the toilet and you're passing urine now, and I said to you, stop, try and hold it, you would squeeze yourself. So that squeeze is the pelvic floor, or one of the pelvic floor exercises. There are a few other things that can be done to help to strengthen the pelvic floor, but this is one that you can do by yourself. And so getting into a pattern excuse me, of doing a few of these exercises, you get into a regular routine, could help to strengthen the floor, and could help with some of those symptoms. Now, this is, at home, that you're doing this by yourself. And if it doesn't help, if your symptoms are a lot more severe, then you should be speaking with your doctor. Of course, there are non-hormone tablets and treatments. We said that we're not going for HRT, but there are some non-hormone treatments or alternatives that can be used. Some of them that mimic estrogen that your doctor could prescribe for you. So again, I think what was really important for me, why I put this one as I thought I really want to talk about this, is because many women tend not to bring, or they tend not to volunteer this subject to their doctor because it is either embarrassing, or some of us might feel ashamed. But you're still, if you're still having a sexual life, and you deserve to have a good sex life. You deserve not to experience painful sex because of something that can be easily treated. It's happening because of the change in your tissues, and we have treatments for them. So please don't allow yourself to be cheated of having those treatments because either you don't know, or because you're too shy or embarrassed to talk about the problem. You only need to talk about it a couple of times, maybe just once, and your doctor gets into the gear of providing you the treatment that you need. Okay, wow. So I think that is the end. Yeah. Oh, actually, I had put a summary, so let me just look at the summary and make sure. Yeah, I think I've covered everything. So I put a summary together. Let me just make sure. So, for example, if you're experiencing hot flashes, yeah, we've talked about diet, we've talked about acupuncture. Those are things that can help, in terms of dealing with hot flashes. Night sweats, we talked about keeping your sleep environment cool, avoid spicy foods, caffeine, alcohol. Those can help to reduce experiencing night sweats. We talked about mood swings and anxiety. There are different herbal preparation, mindfulness, meditation, yoga. We talked about to help to improve your emotional well-being, and we've just finished talking about vaginal moisturizers and lubricants to help with dryness. Then we talked about sleep, magnesium, melatonin is a drug that your doctor can prescribe. Valerian root, and of course, very important, is a bedtime routine that is relaxing and one that's consistent, one that is, so it's not just haphazard. Your body gets used to going to bed at a particular time every day. If it works for babies, it will work for us. So please try it if it's something that if you're struggling with, regular sleep at the moment. Whoa, thank you so much for being a great audience. Thank you so much, JM Master Songwriter. That is such an interesting name. I really appreciate your popping in and chatting, telling us about your experience. Thank you so much. And if you're watching on the replay, I would love to hear from you. Your experience is always great to hear, especially from different parts of the world. And it could make a difference to somebody else who's watching the video and has a question that your experience might even shed some light on. So thank you so much for watching. Please stay tuned for a couple of videos coming out on the channel. Like I said, I'm working on one just reflecting my own personal experience as a doctor, as a woman going through perimenopause, menopause, and just what I found helpful, what I experienced, because sometimes these things are difficult to put into words. There's some that are fairly easy to explain and describe, but there's some that really it takes some time before you realize, oh, is that what was going on? So I'm working on that video, and I hope it will be helpful to somebody. And like I said, if you really want to have a conversation about HRT, if you want us to talk about different types of HRT, the meaning of this type of HRT, why is this different, why is that different, please come and join in next week, Sunday, about the same time, 7 or maybe 7:30, depending on my schedule, and we'll have that conversation. But in the meantime, thank you so much for joining me this evening. It's been great hanging out with you. I hope you have a wonderful week. Let me know how things are getting on. Use the community posts, share your thoughts. I'm really glad for people who send encouraging statements on my community post. They're really much appreciated. Thank you so much. I'm glad to know that you're getting value from our videos, and I will see you again next week. Have a great week.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.